Thanks very much, Dr. Katz, and thanks for the opportunity to be here. The catastrophe in human history 100 years ago made the world understand that some public health problems, for example, influenza, can only be addressed globally at an international level with international collaboration and coordination. Soon as possible, the world took actions to address the need, but that was already 30 years later, after the World War II, in 1947. So within a couple of years, many milestones specific to influenza were set, including two most significant ones. One was in 1948, the same year as the WHO Constitution entry into force. WHO approved the establishment of a flu program, and that is a global influenza program, a 70-year-old program now, which I have the privilege to lead. The second significant milestone is in 1952. A global network called the Global Influenza Surveillance Network was established. The name was renamed as GISRIS, the Global Influenza Surveillance and Response System, in 2011. For anything existing, especially for long term, there must be a reason. Here, the reason is public health needs, driven by the constant evolving nature of influenza viruses. For example, there's no eradication because of the vast silent reservoir of the virus in aquatic birds. And with little known so far of the conducive factor for a virus to acquire human-to-human transmissibility, the emergence of a pandemic strain is considered advantageous. So with all these frustrating facts and realities, the approach to influenza is no other way but step by step, from surveillance to preparedness to response, in a globally coordinated and collaborated manner. And this is where WHO fits. As essential mechanism for influenza is the GISRIS, the Global Influenza Surveillance and Response System, currently comprising institutions from 114 countries. Two figures show the scale of this network. Every year, around 4 million of clinical specimens tested by this network year-round, which means every day 11,000 specimens tested worldwide. Another figure is 20,000 virus specimens are being shared every year from countries with collaborating centers for advanced analysis. In the emergency situation, for example, in 2009 and 2013, GISRIS demonstrated its value in capacity and capability. For influenza control, vaccine, although not perfect so far, is a primary intervention. The current status of the development entails that the viruses contained in the vaccine must be updated timely in order for the vaccine to be effective. Such update is done twice a year for seasonal vaccines, ad hoc timely for pandemic and pre-pandemic vaccines. And the process of the update is extremely complicated and taken by the WHO's GISRIS system. So influenza vaccine is an excellent example of public-private partnership due to the fact that the current vaccine cycle has extremely tight time frame. In order for the vaccine to be available in the market before the influenza season, smooth, effective, and timely interaction among key players are taking place year-round. So here is an example. Right after the WHO's recommendation, routine teleconferences organized by industry and chaired by WHO, involving manufacturers, GISRIS, regulatory agencies, on every critical aspect on vaccine process. One detail is that of the potency reagents, the antigen actually is contributed by manufacturers. So for effective influenza surveillance and control, including effective vaccine response, there are three keywords. One is timeliness. The current knowledge and the technology status is that the control measures are often behind the virus evolution. So how effective these control measures could be really depending on how short the lag behind the virus evolution could be. The second keyword is sharing. An important virus strain could emerge anywhere in the world, and many responses actually are not individual country can handle, but can only be handled collectively globally. And the third keyword is partnership. Throughout the path from surveillance to preparedness and response, these are all true global teamwork beyond health sectors. In addition to vaccine manufacturers, WHO has closely been working with other sectors and initiatives. These three keywords, plus research and innovation and global coordination, as Rick this morning said, altogether is the key to address the problem of influenza. So to finish by saying that the world does have a solid foundation built and strengthened in the past 66 years. This is a precious asset of the world that is the GISRS, the Global Influenza Surveillance and Response System, a system fostering trust and sharing. And may the system, GISRS, be strengthened further to save life and improve well-being in the threat of influenza. So time is really running out before the next pandemic hits. So all of us will need to act as from now on. I'll stop here. Thank you very much.